Hi everyone, my name is Julia Tang. I'm a physical therapist at Breakthrough Physical Therapy, and today I would like to take you through a group of exercises that I use for people with back pain. So a lot of the times people, when they have kind of an acute flare-up of back pain, they'll just sit down and say like, oh, I had to lay down on the floor or just sit down the whole day or I lay on my stomach and I just couldn't do anything. And what I like to tell people is the worst thing that you can do if you have an acute flare-up of back pain is nothing. So some of the best things you can do are light, gentle exercises to gently activate the core and glute muscles, which are important muscles to support our back, and also just to get yourself moving, keep your muscles warm and activated. Usually what happens when you have a really big flare-up of back pain is all your muscles that support your back just shut off. That's your body's response. And so these are some exercises that I like to use to turn back on your supporting muscles and help reduce some of your symptoms. So let's get started. So the first few exercises are going to be down here on the ground. The first one I like to do is just a gentle bent knee trunk rotation or bent knee hip roll. And this just helps activate the core very lightly and also getting a little bit of motion through those segments, which sometimes helps calm down some of your back pain. So you lay on the ground with your knees bent up, and you're going to very, very lightly draw your belly button towards your spine. It's just a teensy bit, and you just let your knees fall to one side and then the other. So all that's happening is your hip lifts very slightly off the ground, and then you go back the other way. So it's just really gentle activation of your core muscles and get a little motion through your spine. And you're supported by the ground here, so this shouldn't be too painful. As you go, you can rock a little bit farther from side to side, but there's no need to push. You don't have to flop like all the way over by any means, unless it feels good. But it's just kind of a gentle rolling back and forth here. Okay? So the next one is going to be a TA activation exercise. So the way to find your TA, or your transverse abdominis, is you get your hip bones, the point of your hip here, drop inside into that soft part, and then draw your belly button in slightly. And if you know how to do it, you can also do a Kegel or lift your pelvic floor muscles. And you should feel the soft muscles under your fingers kind of get a little more firm. So that's your TA muscle activating. So hold that TA activation, and then you're going to slide one heel along the ground, inhale, and then exhale as you pull it back in. Then repeat with the other side. So inhale, slide out, exhale, slide in. And so you can just keep going back and forth here while maintaining your steady breathing and maintaining that TA activation. If this is too easy, you can extend your leg parallel to the ground instead of sliding your heel out. But this is a little bit of a step up. Really important that you keep your back flat on the ground. If you start to feel it start to arch like that, if it's coming off the ground, you don't have good core activation. So really keep that back flat on the ground. So that's a couple options there. The most difficult one is you can do a march. So start up here, march one leg down, keeping your knee bent at about 90 degrees, keeping that TA muscle activated, and maintaining steady breathing. Inhale, exhale. Inhale, exhale. So this is pretty advanced. So if you're having a lot of back pain, you may not be up for this one, but it's just an option. So the next one is a glute bridge. So your glute is those are big supporting muscles of your back. And so here, you're just going to, again, draw that belly button towards your spine, and then squeeze your glutes and lift your hips off the ground. So really important that you're not arching your back here, because that's going to use your back muscles too much. You're squeezing your glutes to lift your hips up and keeping your core engaged to keep your back nice and straight here. So simple glute bridge. This just helps activate those supporting muscles for the back. Okay? So the next one is a prone leg extension. So you're going to lay on your stomach, and you can either kind of be up on your, have your forehead flat on your hands, or just be slightly up like this. But what you're going to do is just you're not going to lift your leg, but you're going to think about lifting your leg off the ground. So you're just kind of extending one leg and then extending the other leg. And so this will help activate the stabilizing muscles in your back called your multifidi. So it shouldn't be a big leg extension, back extension. You're just barely extending your leg. Try and lengthen through your heel. And you can put your toe down on the ground. Just extend there. And so that'll help get your glutes and your little back multifidi here. So I call this prone leg extensions. Okay, so the next one, the last one down here on the ground, is going to be a quadruped kickback. So you're going to be on all fours here, and you're just going to, again, draw that core in, keep your hips nice and level, and extend your leg straight back here. So really extending through your heel. Again, you don't want to be arching through your back like this. Keep your core nice and level, hips nice and level. Really use your glute here to lift your leg, get it all the way straight. If this is too much for you to start, that's fine. You can just start a little bit lower, just slide your leg out and extend it. So this, again, is going to use your core muscles to help keep your pelvis stable and your hips stable. And it'll help activate your multifidi, again, those little back stabilizer muscles. Okay? So a couple options here. Just extending your toes back, sliding on the ground, or lifting your leg all the way off the ground in that quadruped kickback. Okay? So the next couple exercises will be standing up or sitting down on a seat here. So the next one I like to do is either a mini squat or a full squat. Again, a squat is a really big core exercise, glute exercise, quad exercise. It really gets your hips and your core involved quite a bit, which we want to promote when we're trying to deal with some back pain. So you can either do a mini squat first, just hinge your hips back and come up. This is a good way to practice your hip hinge. Instead of rounding through your back, you just want to stick your hips back and get into that mini squat. As you get a little more confident and if it's less painful, you can kind of reach down closer and closer to that chair, or you can sit all the way down in the chair and then stand all the way up, focusing on squeezing through your glutes as you stand up, maintaining a nice good core control here. So this is another exercise you can do. Really working on that hip hinge here. So hinge hips back and then come up all the way to standing. Okay? So the next one I like to do, which also works on that hip hinge and a little bit of trunk rotation, is you get into a really mini hip hinge and then you're just going to rotate slightly from side to side. Really small rotation. So this is another one to work on those multifidi, those back stabilizing muscles. So from the front, mini hip hinge, and then really just very small amplitude rotation to either side. If that's not working out for you, you can sit down. And again, just small rotation side to side. This will get your obliques a little bit, activate those core muscles and those multifidi. Okay? So the last couple exercises are going to be some stretches here to help relieve some of the muscles that can be really tight and overused when you have a lot of back pain. The first one is your hip flexors. Your hip flexors really pull your pelvis forward and pull your back into that arch, which can cause some pain. So the way you stretch it is you can leave one knee down, one foot in front, take your pelvis and kind of tuck it under a little bit, and then lean forward into the stretch here. And you can just hold this for about 30 seconds. What you want to make sure is that you're not arching and then leaning forward, because then it's not so much of hip flexor stretch and you're putting extra pressure on your back. So tuck that pelvis under and then lean forward here. Just like that. Then the next couple are on the ground. We have a simple knee to chest stretch, which can also help. One, it stretches the glute on the leg that you're pulling towards your chest, and it can get the hip flexor a little bit on the straight leg too. So keep one leg straight, flat along the ground, foot pointing up, and then pull one knee in towards your chest, and just, again, you want to hold this for about 30 seconds. Okay, so that's your knee to chest stretch. The next one is going to be a figure 4 glute stretch. So you want to stretch out those glutes. Sometimes those can be really tight, putting extra pressure on the back. So you cross the ankle of one foot across the other knee, and then you can pull on your shin. You should feel a nice deep stretch in that glute. If that's too much, you can just hold the back of your leg. If you want a little bit more, sometimes you can straighten and then pull both. Get a little hamstring stretch in there too on this straight leg. So again, holding this, whatever variation you choose, for about 30 seconds here. Okay? And that's it. Those are the exercises. Those are just a little grouping of few picked exercises that I like to use when people have an acute flare-up of back pain. These are some of the things I do when my back gets a little bit sore from overdoing it somehow. And so hopefully this can help you too. Thanks for watching.